I wanted to first start by this great little wheel, because I think it's important to remember that whether you're a clinician helping a caregiver or you're a caregiver, you're all in different parts of that journey, right? So me as an outsider may instantly say, you need this, this, and this. However, what are you ready to receive, right? You may not be there yet. And so I really appreciate this wheel. It says, I receive to keep my own wellness. I receive support from those who understand. I receive a fresh start at any time. And then what do I want to receive right now at this moment, right? I think it's important, again, we may come into your situation, we as social workers or clinicians, and talk to you, and we may identify something, but we want to meet you where you are, and what are you ready to receive? Okay, so some types of resources, and I was actually reflecting back to Dr. McCullough's presentation, and when she was talking about that preparedness planning, one of the things is that social workers are really a great piece of that preparedness planning, because if you want to see what does that care location look like, well, let's talk about what resources are available to support your decision or your loved one's decision to maintain that care. And the way we do that is we complete a comprehensive biopsychosocial assessment to really assess what may be available to you, and also to consider that sometimes, and I found that many caregivers that I work with, this is not your first time being a caregiver. You've been a caregiver maybe for a child, or maybe someone with special needs, or you cared for another family member, and now you're caring for a more immediate spouse or a parent. And so I think it's important for us to focus on more broadly what resources are available, because it might not be specifically related to your work as a caregiver with someone with dementia. Again, it could be another resource that might be helpful. So what the resources we're going to look at today, so you have some local community resources, there are some state-funded resources, there are veteran-specific resources. Someone mentioned exploring the resources for people who are veterans. There are some private pay resources and also some legal resources. So when we consider some of those local community resources, they can be specific to the city that you live in or the county that you are in. They can be specific to an age. You might have to be a certain age to be eligible or have a specific disability. It could also be a need. What specific need do you have? And of course, there's also funding limitations. So if you live in Clay County, for example, some things that might be available to you would be Aging True. So Aging True is the Council on Aging for Clay County and Duval County. And for them, they actually have an age limit of 60 years old, right? So that's a resource that's county specific and also age specific. There's Clay County Community Services. They can provide things such as emergency rental assistance if you need some financial resources. They also had a paramedicine program that helped people who needed immediate help and tried to avoid going to the ER, having someone, a paramedic, come to the home to provide some medical attention. And there is the Clay County JTA, so if you need paratransit transportation, if there's a transportation need, they're also able to provide transportation. And Mercy Support Services, that's kind of like a referral center, so they have a bunch of resources there for people who live in Clay County and need resources such as affordable housing. Again, they also have some rental financial services as well. And then we have more examples for Duval County. Again, Aging True is in Duval County. They provide services for 60 and older. Meals on Wheels, that might be something that's very common that people may recognize. That's something that they do. There's the Beaches Emergency Assistance Ministry. So if you live in Jacks Beach, for example, that is specific to people who live in Jacksonville Beach, and they have food pantries, they have case management, lots of education, lots of services that they provide. The city of Jacksonville has a senior services division. One of the things that I really like about them is they have something called the Independent Living Program. So if you or a loved one have a memory impairment. They provide a volunteer that comes to the home. They can come check on your loved one. They can, do things like look, make sure they have enough food, take them out on errands, and go accompany them. So touching on that isolation factor, right? That you have someone engaging with them, and also just as another touch point for safety, ensuring that things are okay. So I really like that program that they have. There's also the City of Jacksonville Emergency Assistance. So again, that's a financial resource. Yes?
Do you know how to get in touch with the city for this independent living?
I do, yes.
Will you provide that at some point?
So all of this information, we actually, if I can connect you to one of the social workers on my team, they can get all of that. Anything that you want from this presentation, we can get you connected to those resources. And then also the, again, JTA Paratransit that is also in Duval County. So that is another resource. For Nassau County, you have the Nassau County Council on Aging. They're basically what Aging True is for Duval and Clay. That's what Nassau County Council on Aging does. They do Meals on Wheels. They do some senior centers. They have some in-home services. So that's what Nassau County Council on Aging does. There's the Nassau County Transit, and I think this year actually JTA is, that transit service is under JTA now. And then they have senior centers available. In St. Johns County, you have the St. Johns Council on Aging. Again, most of the Council on Aging do very similar work, and the St. Johns Social Services and Care Connect Plus, that's what the little plus sign. So they are actually a very comprehensive program. They partner with Flagler and UF Health, and they can do like prescription assistance, also look into rental assessment. They have a robust case management services. So that would be a resource that I would connect people because it's very comprehensive. And then Safe Track. So, and it's not on here, but the City of Jacksonville also has one. So if you have a loved one that may be at risk for wandering and you want to register them, that's what the Safe Track does. You can register them, and so if they are found, they can have an appropriate response and get them connected to back to the family. So if you guys hear of those like silver alerts that happen when someone is wandering or found missing, this is a great way to get your loved one registered and kind of having eyes on someone if they do happen to wander. And then some more additional resources that kind of don't necessarily fall but in any specific category, but they serve all of Northeast Florida. Like I mentioned, that the City of Jacksonville has an independent living program. The Center for Independent Living is separate, and they do things like provide you durable medical equipment. So you need a wheelchair or your loved one needs a wheelchair, and Medicare says, nope, you got one 2 years ago, we're not gonna give you another one. What do? Can you really afford to pay for a new wheelchair? So one of the great things that Center for Independent Living does is they partner with Brooks Rehab, and they have what's called a loan closet where they have equipment that you can get for free. It's called a loan, but they pretty much give it to you. And so you can, whatever they have in stock, we're able to get for you. So I think that's something that's really helpful, again, reducing that burden of having to pay for certain equipment. Catholic Charities does a lot of financial resources. The Department of Children and Families, so DCF, they are actually a great safety net for any urgent resources for things when there's a crisis situation. They're able to help get some emergent in-home resources. Heartfelt Ministries is also a great resource, but with that you have to be 70 or older, so this is one of those that's a very age-specific resource. But they do a lot of things like small home repairs. They could do a little bit of transportation. They can also, set you up with some financial resources as well. Lutheran Social Services, one of the big things that they do is they have a representative payee program. So let's say you are working with someone or you have a loved one and they're really struggling managing their money, and they're really not in a point that they can manage their money anymore, but maybe you're not comfortable taking over because it could be, maybe it's a friend that has no next of kin and someone needs to help them manage their money, but maybe it's not best for you to do that, they have a representative payee program so that they will become the payee and they will manage that person's money and make sure that that it's managed appropriately so that they're not victims of scams or spending. I actually just had a call with a nurse and a social worker the other day about this woman who is, well, I would call like she's being catfish, but she is spending all of her money to somebody that she's never met, and she's been doing that for years. And at this point, she's being evicted from her independent living because she has no money. And so those things unfortunately happen. And so trying to get her connected to someone that can help her manage the money to stabilize the situation. Another great resource is the North Florida AHEC. So they're the Agency for Health Education. So they have some support groups. And this is also all encompassing. So if you have a chronic disease, they have lots of education. They, again, support groups across the disease spectrum. So if you have heart failure, diabetes, so lots of support groups. And then, of course, the United Way 211 is also available. And so some state-funded resources. So there's a state-funded resource called Home and Community-Based Services. I put a little asterisk because that one has very specific financial and medical eligibility, and we'll talk about that. There's grant-funded programs. There's the program of all-inclusive care for the elderly. So that is the PACE program that Dr. McCullough mentioned at the beginning. And then also the local councils on aging. So for state-funded resource, as of January 2025, these programs, the current income limit, so that is the individual income limit, so not if you're a couple, it's the individual income is $2,901. And the asset limit, so income limit meaning the money coming in for that individual person, and then the asset meaning any other money, whether that's 401ks, IRAs, any savings, that limit is $2,000. Now for some people, that's great. For some people, they say, that I make too much. And so we'll come back to what do you do if you feel that you make too much, or I know families are quick to say, well, I don't qualify. We'll come back to that, but I did want to let you guys know what those limits are at this time. So what does home and community-based services do? So home and community-based services start with our friends there at ElderSource. And what you have to do is you do a screening assessment. So there's a phone assessment that you complete, and then you're put on a wait list. And then after you are pulled from the wait list, there's the CARES. This is through the Department of Elder Affairs. They come out and do an in-home assessment to make sure that what you said on the screening assessment matches the person that they're meeting and seeing face-to-face and doing that assessment. And then they determine the eligibility, so whether yes, you qualify or no, you don't. And then once eligible, that person receives Medicaid long-term care, and that benefit includes Medicaid coverage. And there's no cost to getting that. And I put an asterisk by the waiting list because this wait list is not like a waiting list like you and I think about. So when I call a waiting list, that means, okay, I called today, and now I'm number like 500 on the list. And then whoever calls tomorrow, they're gonna be like 502 or 600, right? That's not how this waiting list works. This waiting list is a weighted waiting list. So based on how you answer the questions on that screening assessment is where you lie on the waiting list. So even though I called today and someone calls tomorrow, they may go ahead of me because they are demonstrating that their need is higher. So something that can be difficult for caregivers is if you say, oh, well, I do everything. I do this, I got that. So the Medicaid's gonna say, oh, well, what do you need us for, right? You have it all. And so it's really difficult to express that you need that help. And so this is one of the things, we actually have a team member on our social work team that is dedicated to walking people through this process, because it can be difficult to say, well, I'm actually not able to do as much as I feel that I am able to do. I even had a family once that I worked with that they told me, well, if I was scared that if I told them I wasn't doing the best, that they would come and take my loved one, right? I think it's a fair concern. And so really just providing a lot of education and support to families of how to navigate this process, because it is very complex, is something our social services team really enjoys and wants to do. Yes, ma'am.
Does Medicaid long-term care benefit ever increase?
So,
Because, and the reason I
Mhm.
ask, excuse me, because every assisted living facility I've checked out, they increase, the rent increases every year.
mhm.
So does that follow the increases?
I can't answer that with certainty. You would hope, but again, these are Medicaid programs, right? So yes, so the way, and to your question, so the way Medicaid long-term care also works, so essentially you're bringing care into the home. This is why it's called a home and community-based service, right? This is care in the home. And one of the benefits is that if you need a higher level of care, so if you need to go to assisted living, Medicaid can help towards room and board. And so a lot of times when someone is eligible, they need to go to a facility that's in network to whatever Medicaid benefit you get. However, it only covers room and board, so there's more and money that needs to be paid, and typically that is the person's Social Security benefit helps cover the rest of the cost. But with increasing costs, I don't quite know that answer. That's definitely a great question that I would love to research. I have not really had a lot of patients that had Medicaid where they lost their housing because the benefit didn't, maintain. I mean, the cost of living with Social Security maybe helps balance it. It's not a lot, but no, that's a really good question. Thank you for asking that. And then separately, so grant-funded services, so those are also with ElderSource, very similar process. And then once you're eligible, you receive benefits from a grant-funded program, but you don't receive any Medicaid benefits, right? So you could get some in-home care, some Meals on Wheels, but you don't receive that Medicaid benefit, and there's typically a cost, which is about 3% of the household income. And one of the other differences too is home and community-based services, they have that financial and medical piece. The grant-funded services, if you are over income, it doesn't matter that you can be over income or have more assets. That's not a factor in receiving the benefit, but it is not as comprehensive as the home and community-based services or the Medicaid long-term care. So what are the benefits? So as you can see with home and community-based services, there's case management, transportation, home-delivered meals. You can get in-home caregivers, incontinence supplies. You can get home modification if you need a bathroom modification. If you don't want to receive care in the home, but you want to have your loved one go to like an adult daycare, it can pay for those benefits. You can get the personal emergency response, so like a fall alert. And then of course you also get Medicaid benefits, meaning your loved one or you would have Medicare primary, and then you have Medicaid. So no out-of-pocket costs, full coverage, reduced medication costs. So it's, again, very comprehensive. For grant-funded, you could get certain benefits. It depends. There's different grants, and each grant provides different services. And they may include case management, home-delivered meals, incontinence supplies, and adult daycare. And then the last state-funded resource would be the program of all-inclusive care for the elderly. So this is a comprehensive wraparound services, and they have all medical care in one location. I don't know if you guys have ever seen those PACE vans. They have some vans that drive through the community. The PACE Center is located off Ramona Boulevard. I think that's considered kind of the west side. So that's where the actual center is. It's right next to a community hospice building, I believe. And it's a really lovely center. They have like a adult day set up, and they have snacks and breakfast, again, all tied there, and the person will go there for their medical care. They can also go there for the day or the week and spending time to get picked up and then brought home. So it's a really great resource. And then maybe you have someone, again, you're a caregiver, maybe it's not dementia, but you're caring for someone and they're under the age of 60. There's some other resources. So you have the home care for disabled adults, and that's done through the Department of Children and Families. You have the community care for disabled adults. So going back, home care for disabled adults, that's a stipend. And then the community care for disabled adults, that is actual more in-home care. And then there's something called the I-budget waiver, which is through the Agency for Persons with Disability, and that's specific diagnosis criteria. So one of the things that would be like cerebral palsy or someone with an autism spectrum disorder, they would be eligible for that. And then there's veteran-specific resources. So I divided them up in these like 3 buckets because that makes it easier for me to understand what the VA does, because it's, well, the who with the VA, right? So if you go to the VA clinic, so VA healthcare, the VA offers home-based primary care. They also can get an aide, so a homemaker or home health aide to come into the home. They have home improvement and structural alterations. We call them the HISA grants that are done through their occupational therapists that can do some home modifications. There's also veteran-directed care where the veteran can kind of lead the care that they would like. They have medical foster homes and nursing home. Another piece, in order to access this, we commonly recommend individuals get connected to the VA, and I can understand the hesitancy or, well, I like this doctor. Well, with the VA, you only have to go once a year. So you can go once a year, get your assessment, get your benefits, but also maintain that provider in the community. Another VA benefit bucket, and these are actually just 2 benefits. There's hundreds and hundreds of benefits, but we typically defer to some of our community partners to help connect individuals for those benefits. So you have the VA aid and attendance. So that provides a reimbursement stipend to a veteran or a veteran spouse, so the veteran or surviving spouse, for their care. So if you are caring for a veteran or paying for care, you can get reimbursed for that. Or sometimes I worked with a family and they had their granddaughter and they paid her, that was her job, and so they used that stipend to pay her. Currently, for the veteran, it's like over $2,000 right now, and I think for the spouse, it's like $1,500 or higher. Maybe even higher now. So it's not nothing. It's a good reimbursement. And then for those who may not be eligible for the aid and attendance benefit, there is the VA dependency and indemnity compensation, and that can be extra money on top of, let's say you are getting VA disability or a VA pension already. That's some extra money as well that can be used for care. And then, of course, the VA has the VA burial and memorial. Oh, yes.
Do you have the qualifications for individual medical hospital?
I do have a flyer on that. Yes, I do. Mm-hmm. So see me, and then I can get that information to you. Okay, and yes. She asked if I have the qualifications for entry into the medical foster homes. And I told her I do have a flyer about the VA medical foster homes. And some additional veteran-specific resources, that would be working with veteran service officers. Each of the counties have different veteran service officers, and also the VA clinic themselves has a veteran service officer. We also work with Veterans and Families of America. That's a resource that can help get that VA aid and attendance benefit. The National Association of Veterans and Families works very much similar like the Veterans and Families of America. There's the Vet Center that provides mental health support, and the 5-star Veterans Center as well. And then some private pay resources. So there's lots of resources available for private pay if you have the funds to do it. So there's caregiver agencies that you can pay for in-home private care. A geriatric case manager. So that's typically a nurse case manager that can come to the home, do an assessment. They're able to accompany your loved one to their appointments, have that real medical knowledge and feedback to help with the plan of care. Some people have long-term care policies that they paid for years that they may need some support in activating, which can also help pay for care or pay for care in assisted living. There's placement agencies. So the way they work is they can help find placement for your loved one, like if they need to move to an assisted living, and they get like a finder's fee. So they'll do a free consultation with you, but they get a fee from the assisted living facility. That's how they're paid. And then again, specialized transportation that can also be private pay. And then legal resources. So there's some free legal resources, or those that can be at a sliding scale. So the Jacksonville Area Legal Aid, the Three Rivers Legal Services, and then also if there's an extreme situation and their guardianship is needed, there's the North Florida Office of Public Guardian that can help. And then back to where that chart that that had that financial information. If you see that maybe you are over income or over assets, we strongly recommend working with a board certified elder law attorney. They have some magic with their numbers that they can get you qualified. They do very frequently. Sometimes you have to create a trust. Sometimes they've done service contracts. They've done a lot with patients I've worked with that would typically not qualify just on the surface, but have really helped them. And also maybe if you have plans to leave money for family or children, and you want to preserve that and you don't want to use it all on care, they can really help support that goal. And then additional resources, I know Victoria mentioned some. So you have the Alzheimer's Association. Again, if you're having trouble getting to the doctor's office, we do have the house calls program with Baptist Health. And like Kayla, who presented earlier, the speech pathologist, we encourage cognitive assessments through Baptist Rehabilitation. If you have a person with dementia or mild cognitive impairment, Mayo Clinic has a great program called the Habit Program. And then through the Council on Aging, they have an integrated memory enhancement program that meets a couple times a week. And they do a lot of activities with individuals. And then always we're touting support groups. So the Acts 2 support group through Florida State University is a support group for African American caregivers. So really great resource. And then Reach through the VA, and then T-Care, again, through Elder Source. They do tremendous job with support groups. And that was it. Any questions? Yes, Carly. Yeah.
I have some family members or patients who unfortunately fall into that bucket you mentioned initially with Elder Source, where perhaps the whole story was not told, or there was some shame or guilt regarding the inability to provide care. What time frame can they be reevaluated by Elder Source? How do I help support them? I've got care coordination involved, but they were asking me, like, how soon, because I know I didn't fully tell the whole story and I need more help, how soon can I be reevaluated?
Typically, if they've had a rehospitalization, that would be a good time, or if there's a new diagnosis. Or I also just say if you as a practitioner see that there's a change in function, we can always ask Elder Source, like they need to be what we call reassessed. And then they'll say, well, why? And again, Elder Source is here, I won't speak for them, but those would be a good thing we can say, this is why they need to be reassessed. Mm-hmm.
Yes.
What do you do if you're having a challenge getting an older parent to realize they need some of this help? Are there resources that can provide some strategies for talking with them? Certain things like different healthcare surrogate, or perhaps even taking a cognitive test that would be really tough to say, I think it's time to take this, if they don't think they need to.
Yeah, no, that's a really good question. So some of the things, and I think we as clinicians have to do what a lot of caregivers have to do, is we have to think quick on our feet and out of the box, right? Like, oh, well, how do I do this? So I know sometimes it's, I guess they call it reverse psychology, but say, well, then prove to us, right? When it's well, then just, okay, I think this will show that you don't need us, right? Doing this test, that's gonna show us you don't. Or some other things that may be helpful is it may have to come from not the family. And I say that because that's usually where the strongest resistance is when it's the person closest to them. But sometimes if it's from the physician or it's from another clinical team member, sometimes people are more receptive to that, and just framing it in a way that we're not trying to take away, we're trying to give you support. So yeah, and again, I think working with our social work team, our big care coordination team, we actually all, Dr. Bartfield, Dr. McCullen, we all work together, so we're in this collaboration with families as well. Thank you, everyone.
Thank you so much. Such great information.